Our next interview is with Bethany Grabher, VP of Accounts and Marketing at Sift Healthcare. Bethany, good to meet you. That's yours. And I'm excited to learn about what Sift Healthcare is up to right now. So give me the lowdown.
Well, Sift Healthcare is data science for healthcare payments. We drive predictive analytics into the revenue cycle and provide real-time payments intelligence.
Break down the revenue cycle for me, for anyone who's viewing who's not familiar.
So it's not sexy, but the revenue cycle
very
is
important.
Very important. The revenue cycle is how healthcare providers get paid. So it's how they collect from patients, how healthcare providers collect from patients, and then how they get reimbursed from insurance payers. And it drives their entire margin, their bottom line.
Okay, so what's the platform you're building? How are you improving the process?
So Sift provides a HIPAA compliant and cloud-based data platform. We ingest massive amounts of our healthcare providers' payments data, and then we normalize it, we organize it, and we make that data accessible and usable. So healthcare providers have tons and tons of data, and most of it goes totally wasted. So we make their payments data useful, and we use it to drive machine learning models that help them get better at collecting from patients and get better at working with insurance payers.
So let's get really practical. How is life better with Sift kind of in the back end? If I'm trying to reimburse, how is it giving me intelligence? How am I changing my behavior?
Well, at a high level, every year over $240 billion are wasted in medical billing. Just pure waste, and that has to do with human capital and time, and we cut that waste. And then with the payments intelligence, we allow healthcare providers, mainly CFOs, to look at their payments and their revenue operations like a portfolio. Pull levers on different plans, look at different patient segments, and really get smart about how they negotiate with payers, how they handle their operations, and how they handle their labor force.
Yeah, I know we ran a story about Sift at one point, and I recall there being a narrative about the role that revenue cycle improvement plays in keeping hospitals open. Just the fact there's a lot of rural hospitals that are closing and revenue is an issue. So how does Sift Healthcare help in that situation?
So margins are razor thin in healthcare, and especially in smaller hospitals, they don't have access to the same kind of predictive analytics and data science that an insurance payer has or a large healthcare organization has. If they can leverage some of that data, they can start proactively working with patients on payment plans. They can start chasing the denials that are actually going to get paid. It helps them focus on where their money is going to come from, and it helps them maximize the amount they're going to get from each patient. So we give rural hospitals and smaller regional healthcare systems an opportunity to use intelligence that helps them drive more revenue and accelerate cash flow.
Very nice, very nice. Okay, so here we are, starting out 2020. What are the things you're looking forward to, the milestones for Sift in 2020?
So in 2020, we are adding to our data science team. We have a lot of healthcare providers who are coming on board, and we're scaling very quickly. We have a new dashboard that really shows a portfolio view of healthcare payments. And things are happening so quickly that as soon as I'm excited about something, it's on to the next thing.
That's a good place to be.
Really good.
Exciting to have you here at the festival. What do you think is valuable about being in a community like this, being at an event like this?
It's really amazing to hear what everyone's doing and all the areas where there's innovation and all the things that people want to do to improve health. And I always think, all these things are wonderful and great, and it reaffirms how important it is that we help make healthcare organizations financially solvent so that they can do these things that really advance the mission of care and innovation.
I personally love the companies that are operating in the background and enabling other people. You said it's not sexy, but it's so important. And those are kind of my favorite businesses. So keep up the great work. I hope you have a great rest of the festival, and we'll be watching for you in 2020, okay?
Thank you.
All right, thanks, Bethany. Have a great afternoon, all right?